Hello, I'm Lee Mack. I'm with Healy Medical. I'm Chief Medical Officer for the company. And this is a training tape for the distributors for veterinary medicine on the SNP-G gel, which stands for silver nanoparticle. The G is the gel. The history of the particle, this is a silver-based ion that is missing two electrons, which makes it positively charged. And the history is that it already is 510K cleared back in 2008. Uh, the clearance number is K09226 for those of you who'd like to look it up, and gives you the indications. It's actually cleared as a medical device and not a pharmaceutical product. So that's what's going to make it different than a lot of the wound dressings that you're used to seeing out there. You may rep now. The difference is 99% of those work chemically. They're usually a suffocant that will disable the bacteria or possibly the viruses chemically. This works mechanically at the nano level. It pulls an electron from the bacteria and ruptures the wall. Bacteria is single-walled microorganisms that are water-based. So once you pull an electron from the wall, it ruptures it and thus dies. On the virus side, this particle actually is manufactured in a patented manufacturing process where it actually creates a particle that resonates at approximately 900 terahertz, and it creates a small magnetic field. So what that does with viruses, the way they grow, is they replicate over to healthy cells. So they take their DNA, replicate over to healthy cells, and this particle actually creates a small magnetic field. So because of the nano size of it, which is actually approximately 5 nanometers in diameter, it creates a magnetic field. It keeps the DNA from replicating over to a healthy cell. So your viruses can't reproduce. They just simply die of old age, and if they can't reproduce, they're not going to grow. So those are the two main functions, if you keep those in mind, of how the particle works. Remember, bacteria, the particle pulls the electron from the bacteria, ruptures the wall. And viruses, it creates a magnetic field that keeps the viruses from replicating DNA. If you take two things from this presentation, take those. Those are two key aspects of how it works. So it actually works mechanically. So your doctors can use this with any other kind of chemical drugs that they're using, any other pharmaceuticals, steroids, anything like that, steroidal antibiotics. You can use this in conjunction with those and not have any contraindications. Now, you probably heard of, it's silver-based. It is a silver-based ion-coated particle. With a silver-based technology, you'll see a lot of burn victims. They'll use a lot of silver-based technology for bandages and so forth to prevent infections in humans. And that's been very proven and very viable way of treating burns, second and third degree burns specifically. So if you keep that in mind, it's good history to the technology. A lot of folks are actually manufacturing it themselves for health food and vitamin shops and things of that nature. And it's just like anything you do in your backyard. It's going to be haphazard and non-uniform. This particle is actually FDA GMP manufacturing guidelines. It's very uniformly manufactured. It is patented manufacturing process, so it is unique compared to some of the other stuff. You'll have some docs bring up the silverdene or some kind of silver-based technology from the 70s, and the biggest thing is the size of the nanoparticle that makes it different, the uniformity of manufacture, and that has the frequency that creates that magnetic field. So that's what's going to separate it from other silver technology products out there. We have over 120 studies that have been done on this with most of them, 117 of them actually human-based studies, and getting a lot of good results. A lot of hospitals on the human side of medicine are using this. There's a prescription in human medicine that's a 32 part per million. This is a 24 part per million. It's a little lower dosage, but the price point is about half of what you'd expect to see in human medicine circles. So you should have a PDF file that looks like this. It's kind of a quick down and dirty. It talks about indications, applications, what is actually in the gel content. You basically have a particle and aqueous gel. And your safety, we do have MSDS. If anybody asked if they need an MSDS sheet, we do have that. It goes over 4 points, which I went over, of how it works. This is probably the best quick sheet to show your doc. It doesn't use pool cleaner, bleach, like some of the other companies that have some, again, going back to the chemical suffocant. Kind of the unique thing about this is you will see a lot of docs are starting to use this inside the patients for orthopedic procedures. We have Dr. Jeff Mayo. He teaches around the nation and actually around the world now. TTA, TPLO, now he's doing some soft surgery classes, and he is actually putting this in patients before he sews up to prevent secondary infections, especially with orthopedic on the limbs and extremities. And good success with that. We have some other doctors that are using it for MRSA cases and ears, and this isn't run-of-the-mill wound dressing that you typically just put on a normal cut. This is something that you want to tell your doctors to put inside a surgical case, inside before they sew up, because it's considered a medical device by FDA and not a drug. The doctors can use it pretty much for what they want. It will be safely removed from the body. We have some new human studies coming out that show how it is effectively, naturally removed as waste from the body within 48 to 72 hours, and it's fairly healthy that way. Nothing gets stuck in the liver or spleen. There's no toxicity that can occur unless you have an animal that consumes a large amount. Large amount would be if you had a cat that maybe a kitten that weighed 5 or 6 pounds, consume about 7 or 8 of these tubes. That being said, you can, the client can take this home with them. If the dog happens to lick it off of a wound or lick it off of an incision area, it's not a big deal. You can instruct your doctors in your practices that they can use it on more challenging cases. If they want to use it on everyday cases, by all means they can. If they can add you need to show where you can add the value of, sometimes questionable infections. If it is potentially a staph or an MRSA or MRC, some kind of mutated staph, it will work against that. Typically, you want to do 2 to 3 applications a day if you do think it's a Staph aureus or an MRSA infection. If you have a burn patient or infection, that if you have a wound that's possibly has some complications or infections to it, this is what the doc should try instead of the typical everyday antibiotic. Safe to use, and if you have any questions, please call us and let us know. We're more than happy to talk about some new applications and new indications. We do have a doctor down in Alabama that uses it for sinus infections on canines and has had good results with that. Second piece of information we have is your safety sheet. This just basically just shows the indication how to use it. This is something you can leave with the doc. This has standard way to use it that they're probably familiar with in a format for typical other wound dressings or pharmaceutical products. But keep in mind, it is, even though it looks and seems like a pharmaceutical, it's actually a medical device. So it's more similar to a titanium screw than it is a suffocant or a bleach-based product that they're using for other wounds. So that's basically your product niche is specialty care, emergency care, areas of the country where there's some staph infections, basically anywhere where it's warm and moist. You'll see a lot harder to heal cases. Even to diabetic animals that are harder to heal wounds, that's what we're seeing in human medicine, that it works well with those cases, works considerably well. So if you have any questions, please let us know. So here's a video of the actual nanoparticle in action against bacteria, and that's seen through an electron microscope, and here is the video. So as you can see from the video, it's a very small particle. It's hard to view it actually working in motion. We're going to try to do some better videos as the year goes on. But please feel free to call us with any questions you might have on how it works, efficacy, human studies, white papers, all that kind of stuff. You got a lot of cards stacked in your favor with this product already. It's not necessarily a new product. Like I said, it's been in the human world for a few years, so you're working with something that's been around for a little bit, and it's very safe. So explore with your practices, new applications, some areas you can use it on that'll be novel, and I think your doctors and your practice managers will appreciate the solution. Thanks a lot, and if you have any questions, email us, email me, or call me direct, and I'll help you and try to walk you through any cases that maybe or sales presentations that may be challenging. Thanks a lot. Have a great day.